Thank you, Mr. Chair. I want to begin, as others have done, by thanking the Honourable Member for Glasgow East and Dumfriesshire constituency for bringing this debate forward. It's a very important debate. And also want to begin by recognising, as others have done, that no one in this debate, despite the strong feelings on this issue, no one wishes to in any way diminish or seek to not recognise the work that the UK Government has done on tackling global malnutrition up to this point. But it is because of that commitment that the UK Government has shown that there are such profound concerns at the moment about threats to that good record that has been set in the current crisis. There are growing concerns about the Government's commitment to the overseas aid budget and the fight against world hunger. And many of us voiced concerns about a diminution of this commitment when the Department for International Development was merged with the Foreign Office, and the Minister will recall the concerns expressed at that time. We were concerned there would be a reduction in focus on international development priorities. We feared this diminution, and indeed many even speculated at that time whether the 0.7% of national income invested in aid was itself in danger. And we were told, Mr. Chair, at the time when these concerns were voiced, we were told that that was nonsense. Indeed, the Foreign Secretary reaffirmed the UK Government's commitment to the aid budget of 0.7% as recently as July. Yet this commitment has been abandoned, and the Foreign Prime Minister, David Cameron, condemned this decision as the breaking of a promise, and I quote, to the poorest people and the poorest countries in the world, a promise that did not have to be broken. We were told there was to be no loss of focus, and the UK Government's commitment to the poorest in the world was not in question, and it was scaremongering, indeed misleading, to suggest otherwise. But now we do fear there is to be a wavering in these commitments. We face a cliff edge in funding commitments, including the commitment to tackling malnutrition at the very time when COVID-19 has exacerbated an already desperate situation. Now, we know that COVID-19 combating that has been costly to the UK. It's been costly to our health. It's been costly to our economy. And as attention is focused on controlling this virus, gains made in reducing hunger globally, in reducing malnutrition, are in danger of being lost. Now, these are not my words. These are the words of Dr. David Nabarro, the World Health Organization Special Envoy on COVID-19, in the context of the 2020 Global Nutrition Report. 1 in 9 people in the world is hungry, or 820 million people worldwide, which reveals the scale of the challenge if those of us in richer countries really want to ensure that the world is fed. Save the Children have told us that 1/4 of children in the world today suffer permanent damage to their bodies and minds because they don't get the nutrition they need. 45% of child deaths in the world are linked to malnutrition. In 2030, 129 children will suffer stunting as a result of hunger. And in the face of that, there are concerns about reduced programmes to feed the hungry. As we speak, there is a food crisis in southern Africa following the worst drought in 35 years, where the number of people at risk of food shortages is expected to rise to 45 million in coming months. And in the face of that, there are concerns about reducing programmes to feed the hungry. This means that international cooperation and all richer countries doing their bit and stepping up to the plate and recognising their role in the global village becomes ever more pressing. We in richer countries, and I don't think this is controversial, we in richer countries have a duty, a moral duty, to come together and do all we can to invest in nutrition, which is vital for the development of a strong immune system and the prevention of protracted health crises. And the 0.7% commitment in that context could not be more important due to the unprecedented economic emergency. We were told the 0.7% commitment had to be temporarily suspended. But this unprecedented economic emergency we face means that the hunger is alongside the hunger emergency in developing countries where millions face starvation. What we need are forecasts of the total drop to the Nutrition Overseas Development Aid budget spending from the start of 2021, an impact assessment that this decision will have on the nutrition programmes, a plan to mitigate the effects of this drop on the world's malnourished, and to provide assurances to the developing world and to people in this House and indeed across the UK who are concerned that this drop in financing will not be extended. It is quite frankly alarming that aid spending is reallocated away from poverty alleviation towards projects that cannot be considered aid projects, such as diplomacy, building yachts. The priorities really need to be reassessed, I think, and I think most people in the UK would agree with that. Malnutrition is a violent and corrosive social injustice that is morally inexcusable and politically and economically unsustainable. As human beings, we cannot ignore or indeed seek to downgrade the starvation and malnutrition of other people that we are able to help. We cannot turn our backs or reduce our focus simply because these people live far away. Longer term, we need integrated international guidelines on the human right to healthy, nutritious diets and sustainable food systems as a critical way forward. Those of us who are lucky enough to live in a richer country, and it is luck, we are filled with hope and optimism with the news of a vaccine about to be rolled out. Indeed, it started to be rolled out this very day. But vaccines are harder to deliver and less likely to be effective for malnourished people when we think of the developing world. The lasting harm diseases which result from a lack of calcium, such as rickets, can have on people, and especially on children, where bodies are still developing, is far-reaching. Children are more likely to grow up with intellectual and economic potential limited. And women and girls, of course, are most affected by famine, as their traditional roles in developing countries make it so. It's harder for them to survive, because they have to care for their families and they have to evade sexual violence if they can in areas of armed conflict. In some cultures, of course, women eat last and least, as well as being subject to domestic violence as family access to food becomes under greater strain. The World Bank estimates that malnutrition costs some countries in Africa and Asia up to 11% of GDP each year. That shows us the limiting and damaging effects of malnutrition in economic terms as well as in human terms. The truth is that the UK government's aid budget has been cut by £6.9 billion this year alone. So all of the good work that we have talked about, and we're happy to talk about, all of the good work done by the UK in poorer countries sadly sits under the shadow of that £6.9 billion cut, at a time when COVID rips through developing countries who are simply not equipped to deal with the consequences of that particular health threat. So we need the Foreign Office to use every diplomatic and financial tool in its armoury to ensure that the postponed Nutrition for Growth Summit in Japan in 2021 is successful and attracts support for financial and policy commitments to end malnutrition. We don't need the international community to give us warm words. We need the UK on the global stage leading the effort on the front foot. The health pandemic must not be used, cannot be used as a reason for cutting back international aid. In fact, the consequences of the pandemic is that in developing countries, an additional 433 children are expected to die every single day, according to The Lancet. Therefore, it's a cruel irony to argue that the pandemic means that the UK must abandon its Millennium Development Goals commitments. Malnutrition is a threat multiplier in developing countries, since those who are malnourished are likely to have lower immune systems. And with a global health pandemic, the significance of this, a virus which preys on compromised immune systems, could not be more profound. So I very much look forward to hearing what the Minister has to say today, and I hope to see her embracing the need for the UK government to do its bit on the international stage in tackling global malnutrition, leading the effort. It's the right thing to do.